Hey, we're back from the break. So anyway, Ray was asking about diverticulitis and diverticulosis. Again, it's a colon problem where the blood vessel comes through the wall of the colon. I guess, blood vessels on the outside have to get to the inside of the colon. And where they pierce the colon wall is a potential defect in the colon. And over time, usually through constipation or wear and tear and certain genetic dispositions, the colon can get weak, and so you get an out-pocketing of the colon, and it looks like it kind of looks like a little sac hanging off of the colon, and the blood vessel is kind of going right by it. So if it gets irritated for whatever reason, that blood vessel can bleed. Now that is a condition called diverticulosis, the bleeding of a diverticuli. If you eat nuts, seeds, corn, or something like that, and it happens to be just right to fit into that diverticuli, then the bacteria behind there aren't flushed out, and they basically set up shop, and when they do, that gets infected, and that's called diverticulitis. You can have diverticulitis that bleeds, but the worst part about it is you can abscess in there, and you can get ruptured into the colon, which can cause a peritonitis and could be very, very...
Or a colostomy bag.
Yeah, no, in really bad cases, that's true. They can have to have surgically corrected, and you have to wear temporary colostomy until such time as they can reanastomose the colon together, depending on how much damage is done in that area. So this is... You may notice it because you're going to get this pain in the left lower quadrant. It's going to basically cause a lot of pain and put fever and chills, and no diarrhea, nothing else. And
it is increased if you eat stuff like popcorn, or if you eat stuff like nuts, or you'll go through 3 or 4 days where you're miserable.
Yep.
You're just miserable.
Yeah, and once you get diagnosed with it, you'll know it again, and you usually take a couple of days of antibiotics and you usually get rid of it. But you've got to eliminate the nuts and seeds from your diet, because if it just gets in there just enough, and that's, there's a lot of fruit that people like to eat, like strawberries and things like that, that basically have seeds in them, and they can get in that. So if you're getting a colonoscopy as a colon cancer prevention, the doctor may tell you, oh, you just had a few diverticuli. Well,
I think that's present in almost everybody over a certain age, though, Mike. It's kind of like osteoarthritis.
Yeah, it is, but they're not.
You don't have to be symptomatic.
No, you don't, but you don't want it to get that way. I don't know. I had my colonoscopy at 57. I didn't have one. I didn't have any diverticuli, so.
Well, you're a specimen.
I don't know, but you're right. I've seen people age 35 that got really florid diverticulosis, and that's really a bad situation because they're going to have problems all their life. So I think there is a genetic predisposition.
I think there is also
to that. And constipation is one of those things that I do believe has a predisposition to diverticuli, only because you're on the pot and you're straining and you're forcing pressure in there, and that can increase abdominal pressure could possibly force those things. So if you take genetic with constipation, you may have an issue. So let's make sure that if you're out there, you're having regular bowel movements. What's regular in the form of bowel movements? Well,
yeah, good question.
Yeah, theoretically every 3 days. But for some, regular is what regular is for you. If you have a bowel movement every morning and you don't have a bowel movement every morning, then you're going to feel constipated, okay? But, here, like you say, fluids are very important. The colon's job is to absorb fluid like a sponge, and it will suck every bit of drop of water out of that stool if it can. So if there's an equilibrium and a balance, that's why fiber in your diet holds on to water in the stool, and it can't get it out there. It's an osmotic gradient that takes place. So, okay, well, hopefully that answers that question, and I don't know, hopefully get a few other callers. I had a interesting thing, with dementia today. I was trying to explain to people a little bit about as our aging population, about using some of the medications and some of the things that are out there. And what I tried to explain, and that the medications that are out there will not undo what nature has done.
What time has done.
What time has done. So what we try to do with these medications is prolong your basically disposition into a tertiary care center, to a nursing home, to an advanced age home or a lockdown memory unit or something along those things. Those are very, very, it's very traumatic for the patient, traumatic for the family. And so if you can delay that, you basically help the healthcare system by delaying that. And I'll give you an example. If the slope of your memory loss is kind of at this angle, and I put you on medication and I change it to a less of an angle, and this intercepts at nursing home at age 80, I may be able to prolong that to 87. Okay, that's
quality of life.
Yeah, that's 7 years that you don't have to go into a nursing home makes a huge difference in the ability, number one, expense-wise.
Oh, yeah.
And number two, you may succumb to another illness or something like that, so you never have to experience, being in a nursing home. And I think nursing home care is, I'm glad they're there, but, my experience is, it's just not a good place for people. But if it is a necessary evil, that's where you want to go to. And I think there's a transition going on in medicine to assisted living, nursing home kind of things, or true nursing homes. And Medicare pays for 120 days of nursing home if you've been in the hospital for 72 hours. After that, they, then you're on your own, and
it can get expensive.
$4,000 a month.
Wow.
So it's not easy to do that, and most people don't have that kind of money to go into a nursing home. So if you're unsure about, if you have a family history of dementia at an early age, or is an early onset dementia, you need to get treated. I don't think there's none of the medication can help, but when you get into this mild cognitive impairment part, when you start having difficulty doing things, that's when you might want to see a physician about, or a healthcare provider about getting on some medication, giving it a trial. Don't wait until you find yourself driving down the street and you can't remember where you were going, and then you get into an amnesia thing and you just get lost. That's when it's too late. So, forgetting where you put your keys, that's not dementia.
Yeah.
Okay. Forgetting where you put your keys and forgetting where
you put your car.
Yeah. Dementia. If you were in a parking lot, that may be okay, right? I mean, if you go to a game and you can't remember where you were, that might be fine. Going to one room and forgetting why you went there, if that happens very frequently, then that might be some concern. But the one thing I start to see when dementia starts to become a problem is the first thing that goes is hygiene.
Oh, yeah.
People, they don't want to get into the bath. They don't want to take care of themselves. They're not, the cleanliness side of it tends to go. And that's usually a reliable sign that you may start having issues with dementia. So make sure, and that's different if you were one of these people that didn't want to take a bath every day. That's fine if that's the way you lived your life. But if you're one of these people that showered routinely and kept yourself clean, and all of a sudden you're not doing that, that's a pattern change, and that becomes significant. So it's a change in your pattern that your family may notice that may be significant, and that's important to bring that to your provider's attention. So, so anything new in your office?
Well, interesting you asked. We purchased a 9-watt laser for chronic and acute pain. And the reason that I went ahead and purchased this laser is because I had colleagues that are still involved in Major League Baseball and in pro football, trainers and doctors that are treating arthritis, injuries, and muscle pain. And I had 2 or 3 of the trainers call me and say, you know what, Craig, you need to get one of these. It's amazing how it works. Now it's 9 watts. It's a real powerful laser.
9 watts is a powerful laser.
But I'm just elated at the success that we've had utilizing it on neuropathy on the feet, tennis elbow, shoulder
problems.
problems.
Is it increasing blood supply?
Yeah, it increases blood supply, which increases the action of the mitochondria in the area to increase the ATP. At the same time, bringing in the blood flow and taking the inflammatory
Components
debris and stuff that's in there out of the area. So you're able to function more.
That's why they were using it for hair growth and stuff
Well,
like that.
that's a whole different. That's
But
a
it's
whole
the same,
different.
it's the same idea
yeah.
because it's basically increasing blood supply. So if your hair follicle is dropping out because it doesn't have enough blood supply, I mean, that's the first thing you see when people go through a lot of stress. You know, they'll just lose their hair because, and then you put this laser on there and it supposedly
Brings in that blood supply into the hair follicle and regenerates it.
Right.
The other thing is tomorrow, you and I have been talking about the functional rehab equipment that we've been waiting to get here from Australia is supposed to be in.
Oh,
so it's just one more component to the wellness center that we've added. I don't know if you've met Dr. Plant, the new female chiropractor. She's also a nutritionist. So we're going to start bumping up the nutritional end of the practice over there, working with people with, for instance, that compound that you were talking about, as far as when you get sick, something, what did you call that? I forget.
That what?
Remember
to check your memory?
No, you better. Oh, where's my keys?
Yeah.
At the very start of the program, you talked about when you get sick, this is what you take.
Echinacea or Sambucol or black elderberry and colloidal silver. And
so we're gonna look at doing more and more of that, being proactive, especially when this Pahrump crud hits every year.
Well, and increasing the nutritional support of patients and giving them advice on what they can do and what they may be deficient in and stuff of that nature. I know we've talked about. There's a lot of gimmicks out there, but it's our job to sort through which gimmicks are there. And we have Marvin on the phone, but Marvin, we're going to go to break. So in just about a minute. So can you hold on through the break? Would that be okay?
Well, I'm going to take less than that.
Okay. Well, go ahead. We still have it.
Okay, Melanie, you had her on there a couple of weeks ago?
Yes.
Yeah.
Yeah, and it was, you recorded it or something like that?
Yes.
Nobody could call in. I just want to let you know, I seen Melanie once.
Yeah.
And she really is a nice person.
Thank you.
And
Very good.
But most of all, she is very helpful.
Well, good. Well, I appreciate that.
That's great feedback, Marvin.
Yes, thank you. Hang on if you want to talk to us after the break. I appreciate you calling in.
No, I just want to let you know. You
Okay.
should have had her on more often.
We will try. She doesn't like the TV, Marvin. She gets very nervous. So people have to work into that. You have to be hams like Creig and I to be able to sit here and talk to the public.
I know what you mean.
Yeah.
I'd be very nervous up there. I couldn't do what you do.
Not a problem. We'll be back after the break. Thank you for calling in.